Welcome, welcome, welcome everyone. This is you're joining NHSA's Parent Gauge Family Engagement Series, Engaging Your Core on Community. As we get started today, go ahead and test out that chat function on your Zoom screen by introducing yourself there at the bottom. It should be a chat button. And you can let us know your name, where you're dialing in from, and we'd love to start off hearing from you a response to this question, something unique about your community at your program. And we'll go ahead and introduce ourselves as y'all get started there. And I'm Sandy Oseguera. I'm here at NHSA. I'm the product manager over Parent Gauge and a couple of other products that we have here that are mostly focused on data. Been here about 2.5 years now, I think. I'm losing track these days. And I'll let Lucretia and Caitlin introduce themselves there as well.
Okay. Hi, everyone. My name is Lucretia. I am the product coordinator. I do quite a bit through ParentGauge as well as with membership. So if you've ever emailed membership, you may have gotten me to give you a reply back. I'm excited to be sharing all this good stuff with you, and I look forward to what we have to offer.
And then, hi everyone, my name is Caitlin Newell. I'm the data fellow here at NHSA. I've been here about a year. Before that, I spent about a decade working in the Head Start program, first as a Head Start teacher, and then on their data teams, on their family engagement teams. I kind of wore a lot of different hats, as many people do in our Head Start family. So really excited to be here with you all today.
Thank you, thank you. And Caitlin, your audio was a little funky. I don't know if that was just on my end, but just wanted to point that out because I know you are speaking later, and hopefully that won't be an ongoing thing. All right, gang. Well, we're going to go ahead and get started. Today, we're going to be going over a couple of different things, mostly diving into how to turn your program into a community hub, why you would want to do that, how to do that. We'll talk about low-cost ways to break down barriers and increase engagement, and how you can leverage data to achieve all of that. Before we get into that, let's take a step back and do a little context and level setting. When we talk about engagement, we want to go a step beyond involvement. What we really want to get into is the idea of partnering with families in lieu of getting families to participate. So, this shift embodies the idea that we're not practicing top-down communication, telling our families and communities what to do, but instead we're in a feedback loop, embodying partnership and sharing goals and outcomes together. One quick note, you will hear us interchangeably use parent and caregiver. Please know that we do mean all people, including grandparents, foster parents, all adults who care for children, ultimately. This is the first part in our webinar series all about family and community engagement, best practices, and what we've learned along the way across hundreds of thousands of parent-engaged parent interviews at this point. Our next session in January will be focused on outreach, including outreach efforts for recruitment, as well as outreach for resources and engaging outside partners. So keep an eye out for that registration as well. Today, we'll be focused on our own program's unique positions to serve as a hub of the community. The community hub approach embodies moving beyond a child-only focus and positions your program as the heart of your community, a place where families find not just childcare and education, but belonging, opportunity, and empowerment. And part of why we do that, my slide will follow. There's a lot of reasons that we do that, but part of it is because we know that this works. Most importantly, the community hub approach works because we know that when parents have supportive relationships with other adults in the community, that it trickles down to better relationships with their children, along with their relationships across the board. And that is what is baked into the PFCE framework and our other Head Start performance standards. By building on our own foundations within our program, our environments and partnerships, we affect positive family and child outcomes. It all leads back to positive and goal-oriented relationships. So let's dive into what we actually mean when we talk about the community hub model. At its core, this model is about transforming your program site into what sociologists call a third space. So you might be wondering what a third space is if you haven't heard of that before. That's essentially what a third space is not your home or work. For kids, not home or school. So these are the places that are comfortable in between spaces where people can just be, where they can just hang out, socialize, connect with neighbors, all without the pressure of having to buy something or be productive necessarily. So this is something that we used to think of as town squares, community centers, local cafes used to be seen this way, where you knew people by name, sometimes not by name, but a lot of these spaces have been disappearing. And a lot of researchers have point to this loss as a key reason why people now are feeling increased isolation and why it's harder to build community. And there's a lot of reasons why we don't have those casual places to connect anymore. But ultimately, when we lose those third spaces, we all feel it, and especially children and families, because there's that saying where it takes a village to raise a child, and we're increasingly losing that village. So the community model essentially is turning our programs into that third space. So, our programs that, yes, they are partly out of need. It is a workspace for all of us and for staff. For school, for our children, it is school. For our parents, it is a necessity. But the idea is that we create a space where folks are commuting here outside of that necessity. So with this model, we create a gathering place that can become a go-to place to share resources, grieve, celebrate, and it essentially becomes an antidote to that isolation that we have in this increasingly isolating world. The overall goal is to create long-lasting relationships and connections to build a community of resilience. Now, there's a lot of positive impacts here. We know that when parents are engaged and involved, their children show higher academic achievements. We see better attendance. We see improved social emotional skills. And when a child thrives when the whole family thrives, right? That's the basis of Head Start, really. You can't separate the two. Embodying a community hub gives parents more opportunities to gain skills and their own capacity, increases social connections, combat isolation. For many families, your program might be their first real network or even their only network. And so a community hub can really give parents a chance to exercise leadership skills, which we'll talk about more in depth later. And those skills are real transferable skills. This also gives parents a voice in their child's programs. They're not just consumers of services, they're partners shaping the services that they're using. And maybe most importantly, this is a place where parents can feel valued as co-educators, as learners, as leaders, and as parts of as vital community members. They're not just the people who pick up and drop off their children. And this doesn't just stop as program participants. This does benefit the entire community. When we create a thriving community hub, the entire neighborhood is going to benefit because we do build that social cohesion and support system. That strengthened community identity becomes something that people take pride in. There's new skills and connections, those networks that can spark economic development. And ultimately, you create a culture of neighbors helping neighbors, and that trickles across the board. So that can be huge because suddenly you have shared responsibilities and shared workloads. One family helps another with childcare, another teaches a skill, someone else organizes a cultural event. It's not all on the staff anymore, and that goes beyond your program. So that's ultimately what the community hub model is in a nutshell. And now here's the thing, you might be looking at this and thinking we're already doing some of this. Again, a lot of this is baked into some of the things that we're required to do and the things that we're already taking an effort to do every day. We have family events, we have parent volunteers, and you're probably right there. But when we survey parents nationally, the lowest ranking score we have in our parent assessment is to this statement that we have on our screen right here. And it's to, I feel connected to other parents and adults. We have our parents rank this on a Likert scale from not at all to very much. And pretty consistently, at least for the last 3 years, we've had parents rank this the lowest out of all of the statements that we asked them to rank. 37% of parents say they feel disconnected from their community. So that's more than 1 in 3 families that are walking through our doors and saying they don't feel that sense of belonging. That can be brand new families, that can be families who are in their last year of Head Start. So this goes across the board. And so then the question becomes, how do we actually fully embody that community hub model? How do we reach this 37% of parents that still don't feel connected? How do we actually make our community, our sites community hubs? So let's start at the very beginning. Let's talk about those new families and how they interact with our programs. Because that first interaction really does set the tone for everything that follows. Is it a quick transaction? Are we asking them to fill out these forms? Here's the paperwork. We'll see you on Monday when the program begins. Or is it really the beginning of a relationship? So as we're thinking about that, go ahead if you feel comfortable in the chat. Let us know who's the first person that new families see and talk to when they walk through that door. And if it's not new families, who is it that families see when they first walk through that door? Who are they first talking to? That makes sense. Yeah. Center director or teachers, family advocates, front desk staff. That makes sense. I know on some of our local program here, they have started doing that where they have that doorbell where you have to like show ID before you even talk to anybody, which it's kind of twofold. There's like it feels really secure, but it's also a little more clinical. So there's a lot of, it kind of depends on how how we feel about it, but it's something to think about, right? Yeah, a lot of family service managers, office staff, and that's something to think about, right? Love it. Yeah, feel free to keep dropping those in there. But what we want to think about is creating a welcome gathering place, right? That's really the hub of the community model. Because it starts from the moment a family walks through your door, maybe even before. So one of the first things we can do and expand on is creating that welcome gathering place for everyone, for children, parents, staff, partners, so that it's accessible as a third space. And I know when I think of accessibility, one of the first things I think of initially is ADA compliance. I'm sure a lot of y'all think of that initially too, which we definitely want to keep in mind. It has to be accessible. We need to be able to get people in. But even beyond that, we should think about, are we easy to access for everyone? Do our neighbors know what services we offer and provide? Is it obvious from the street view what we do and how we serve the community? Because that is also part of being accessible. And again, I think about that twofold constraint of like we have that secure building, but is it accessible then, right? Does that turn people away at the same time? And so one mental exercise that we can do is a first impression audit. So that's where we would do this mental exercise, or you can do this physically. It's probably even better if we can do this physically. But imagine that you've never been in your building before and you're walking in for the first time ever. And let's say you don't have a lot of contacts. Maybe this is the program and I'm gonna go sign up to do this for my child or whatever the case is. Um, and so you're going to walk through those doors and imagine that this is your very first time and identify, are there clear signs? Is there a welcoming person at the entry who greets me? When we're bringing up who it is that greets your parents when they first walk in. Is that a welcoming person? Are they looking up right away? Can I see where to go and what to do? Do I see families that look like mine represented? Um, if I do have to sit and wait, is there a place to do that? Is there a comfortable place to do that? And then does the space look like children and families are there, or does it feel institutional? Those are all things to think about when we're considering how our new families are walking in, after we have engaged in a relationship. That does buy us some relationship later on. But initially, that first impression can matter more than almost anything else. And I know I've seen it, and I'm sure others have as well, where, sometimes families will walk in, and if they're not greeted right away, or if they don't know what to do, that anxiety wins over and they'll leave before they've even talked to anyone because they just didn't know what to do next. So that's something that to think about or to practice is that first impression audit. Even in your own spaces, if you have an office or a space where parents are walking into, that first impression audit might be something to practice every once in a while, just to make sure that we have our families walking into a space that they know that they feel welcome in. Now, when we dug through parent feedback on this topic, and this was more generally what parents said makes them feel welcomed, were things like staff who remembers their name. So that person at the front who is welcoming folks, when they remember people's names, that has such a big impression, especially when it is folks that only see them here and there. It seems like that really makes an impression on folks because they don't necessarily expect it. So they are regularly bringing that up in survey responses that they're surprised when people remember them and that makes them feel really welcome. Um, we also see a lot of parents really appreciate when they do need help or resource assistance of any kind, that they have a non-judgmental environment and that they are getting connection to those resources really helps them feel welcome, as well as follow through. If they bring something up and their teachers or family service advocates, if they come back later and bring that up, that seems to make a really big impression and helps them feel welcome, especially if it's those initial conversations. That seems to have a big impression. So, all of those things to keep in mind at the very beginning are things that really help our new families stick with us and gain those initial first impressions that are going to lead to a lasting, longer relationship that feels like community. So, we've thought about that first impression. So, let's talk about how to build from there. Starting off with something else that you might already be doing, which is bringing on-site partners to your service area. So the idea here is creating a one-stop shop of family services. Some programs are able to do this by bringing those services to their sites. Some don't have to, but this can be dually beneficial for a lot of reasons, especially right now that we're in, for a lot of programs, we're still within those first 90 days. It can be dually beneficial if we can bring things like dental exams or well visits to get checked off our to-do lists, as well as families' to-do lists, so that we can just get it all knocked off all of our dual to-do lists together. And to start off the year, on the right foot, make it easier for our families to get everything done all at once. Outside of doing this, at the beginning of the year, hosting things like resource fairs or showing that we have partnerships with other services helps our families know that they can reach out to us for referrals and for resources and solidifies our relationships with community partners throughout the year. And this can be, I think that this is interesting because, we are all doing strengths and needs assessments at intake as part of our standard practice. But what happens when families have something that comes up after that initial assessment? Do they know they can come to us anytime? Or do they think, well, we already did that form, so I guess that was my one chance to ask for help, and that was the time to do it? Do we pop into their heads when life happens and there is a sudden need for food assistance, especially right now where there is high unemployment rates and things like that? Do families think about coming to us as a resource for that if they're facing eviction or things like that? So ultimately, have we positioned ourselves as that ongoing recess, or are we just a place where their kid goes during the day? If we have these on-site partner services throughout the year, we can show that we are plugged into the broader community and solidify that we are a place that serves as a resource throughout the year, that we can help with navigating other systems as well, and that we can also serve parents as well, that it's not just about the children there, and we are a two-generational approach here. So by bringing on those, bringing partners on site sometimes, that helps just reinforce that idea, especially when it's not just at one time of the year, but again, just re-engaging with that idea that we're doing this on a continual basis, on a regular basis, and that if things come up, that they can come to us throughout the year. Now, some of this community building work is about meeting those serious needs, and that's critical, right? That's probably the most important. But I think sometimes we should get into things that are fun because honestly, this might be where we go from being a resource to really being a true community hub. And that's when we can think about offering things like classes and enrichment activities that go beyond traditional classroom classes or things that are necessities. And so maybe it's parent-child cooking classes or dance lessons. Both of those actually came from parent suggestions when we asked them, what kinds of activities do you want to see at your programs? Things that people actually want to go to, not just things that they need. Because when you create reasons for families to be at your program beyond drop off and pickups, mandatory meetings, and beyond those crisis moments, that's really where community forms outside of those resilience needs. That's when parents start chatting. That's when kids see their friends' parents and feel more connected. And that's when your program becomes a place people choose to be, not just have to be. And that's really the magic of the community hub model. So we have a couple of ideas here of learning spaces that help every generation. And one of those, especially for support groups, there's a lot of subsets of parents that need additional support and things like single and divorced parents. Sometimes they need that additional support. And really all they just need is that space or IEP support and navigation. Outside of doing those actual assessments, sometimes parents want to talk to other parents who have been through those scenarios or want advice from other parents that are navigating that. And again, they just need that space to be able to do that. So those are low cost, lower effort groups that might be beneficial for our parents and that really fill that community need. Now, we have one program that we wanted to showcase because they have been doing a lot of these things, and again, a lot of your programs probably are as well. But Fairbanks Native has a very interesting program because they are in a very rural location. They're in Alaska, and they've been having to kind of build this community themselves there as well. So we really wanted to showcase them and how they've brought a lot of these services on site. A lot of it is out of necessity as well. So some of what they've been doing at their program, education-wise, is they actually brought in a lending library. And they also have a nature trail through their program that families can use anytime. And their goal with that is to promote wellness and learning beyond the classroom. They partnered with their local school district special education services and infant learning program to coordinate therapies and smooth transitions so that they have, part of that is thinking long term about each child's journey as they're connecting to these additional partners. For health, they did bring those services on site. They have a health screening room built into the building with hearing and vision equipment. And then this again was part of their unique situation. They are a native program. They partnered with the Public Health and Indian Health Services program there so that their families can get their screenings, dental exams, vaccinations, and growth assessments without having to navigate multiple appointments across town. And again, this is rural Alaska. So that was really quite a feat that a lot of their parents were having to do in their particular area. So this was something that I think their parents were really we're really excited to have to be able to do it all in that one-stop shop format there. They brought an on-site food pantry as part of their nutrition goals, where they provide meal boxes. They also do monthly cooking projects where families learn and eat together, and were able to bring together a family garden so that community partners donate supplies and parents participate in growing the food. So they basically bring all of these partners and their parents together to serve these nutrition goals, grow the food. Have that on-site food pantry, bring that all together, and are really embodying that community hub model there. They also created a family services room, which is really cool. And I also thought the staff wellness part of that is huge. They have a wellness room where staff can do self-care during work hours because I'm sure all of us know the hardest part of a lot of this really is um, the man hours. The man hours is probably the biggest resource. We'll talk a little bit about bringing parents and volunteers and all of that fun stuff. But our staff, right? There's turnover. There's lots of work to be done. There's a lot of new staff. There's so much to do. And so if you're able to have any kind of dedication to self-care, that can be huge. And just having those little bits of moments to reset. So we included that here too, because staff, they're also a part of our community. And so this is also a part of what a true community hub looks like here. So there it is in action in Fairbanks Native. Their program, and again, this is in rural Alaska. They again kind of had to make it work, and they did. So, just kind of more proof to the pudding that this is something that we can all pull off, if they're able to make it pull off over there. Um, so let's talk about how you can utilize the space you have to make some of these ideas work for you. Now, again, each program is different. We have different spaces, we have different needs. Each of our communities are different. You are an expert in your community and the program that you provide. Now, if you have a meeting space or a multi-purpose room, in some cases, maybe a book club is something that could be hosted. That is a lower effort thing, and you can partner with libraries or things like that, that can help our parents be able to also be included in that in a low cost way. Something I've been seeing pop up in our community here, I'm in Utah, has been free markets. That's been a really popular thing recently, where it's like everyone brings their own stuff. You have to haul it back out, but all you really need is space for that to be available, to do things like a free market or clothing swap, especially at the age range that our Head Start students are at, because they are growing out of their clothes so quickly. If we're able to arrange things like clothing swaps, that might be something that is a popular event that can also really engage with our community. And don't require, large budgets or things like that. They mostly require space and time. Um, and same with those parent groups that we talked about before. A lot of the time, they really just need the space. And depending on weather and things like that, even the space can be flexible. Now, if you're lucky enough to have a garden space like Fairbanks Native has, that can be gold, because there are programs out there. There's gardening clubs. There's master gardeners. Master gardeners, if you look into your local extension office, master gardeners have to volunteer a certain amount of hours to keep that status of being a master gardener. So they're often looking for volunteer opportunities. So that might be a way that you could bring in somebody with an expertise to help you with your outdoor gardens and create a community garden. And again, parents could come in, share those plots so that you're able to grow nutritional foods that could be tie into those nutritional goals that you have. And ultimately, that could be part of creating that community hub is in that garden space. Um, Starting a gardening club where families can grow food together could be another idea there. And again, partnering with food pantries like Fairbanks Native did can be a really beneficial way of using all of that produce, because ideally our families will use all of that, but in some cases you might have a really successful garden and have to to partner with others to bring that out. Another thing that I've been seeing gaining popularity are things like hosting a community fridge, or even having your own little free pantry where your own neighborhood can use that to come grab all of those extras at any time. Those have been popping up a lot recently, where it's you just almost like those little free libraries that you see in some areas. Only instead it's focused on a community, a little free fridge or a little free pantry. So those types of things are can be really beneficial if you have a successful community gardening going. And there's something really powerful about growing food together, because it's such a practical skill and it literally roots community together. Now, in a lot of areas, we have limited or no space. Maybe a garden is a far-fetched idea. I know there's a lot of areas. I came from Las Vegas, so I know that that's not the place where we necessarily have a successful gardening going on. So even without a dedicated space, you can create gathering moments. Things like a weekly coffee morning with you can make that work with just a coffee pot and some supplies like coffee and hot chocolate or tea, some chairs. If you could do that where parents can drop off their kids and instead of rushing out, they stay for 15 minutes and chat with other parents, maybe decompress before work. Those kinds of things can really create those moments of engagement that are less structured but create community. Another idea, if you can't do that, right? Because even that does take some supplies and time are things like a simple bulletin board. If you have a place in your program where we can have a place where people with a high traffic area where we can put up a bulletin board and use it as a barter board. More than announcements from the program itself, but where any parent or partner can come in and post items that, I have this and I need that, or there's things that I have for free that I can offer here, or I can teach you this if you can teach me that. Things like that that get people talking, trading skills, going back to old school bartering. These are low cost, low space solutions that really create high impact connections. And it's really not about having the perfect setup. It's just creating that invitation to engage with each other. Now, with that, I know I've been talking a lot and talking fast, so I'm going to turn it back over to Lucretia so that we can get into this next chat question.
Okay, I just put a chat in there for you guys. Here's the question. How do your parents and families participate in your program currently? What kind of in-class, outside of class help do they provide? We know that these things that we are suggesting take a lot of time and effort that you're already putting in. So if we can find a way that we can incorporate parents or family members to help secure some of those jobs for you, such as putting together, I think Sandy had said a group for disability parents. If a parent could learn to facilitate that and keep it going, that would take some of the stress off of you. So what we're going to do is we're going to be talking about that, about adding those parents in. Looking at these, we have a community raised bed garden that parents assist us with. There you go, Sandy. There's your garden. Family time events, morning mingle. Excellent. That's what we're talking about. Circle of Parents weekly group, snap cooking workshop. That is fabulous. Volunteering on market day. These are all just wonderful examples. I want to say that there was a church that I belonged to, and we used to say that when it came to the volunteering, 10% of the people did 90% of the work. We want to help change those percentages by getting everyone involved. So that's what we're going to be looking at today. Sandy, can you go ahead and go to the next slide for me, please? Thank you very much. So these can be big things to take on, and we've talked about leveraging community partners a little bit, but how can we leverage the parents and the families too? We Most of the programs have parent policy council members and they're already established. We know you have regular volunteers. You have some who can jump in every now and then. But how can we utilize those parents who aren't usual volunteers? We want to integrate all parents and family, not only for their efforts, but also to engage them and make them feel that they're a part of our Head Start community. We have community experts walking through the doors every day. These parents and family members can lead groups and workshops, which becomes opportunity for parents as lifelong educators. See what we did there with the PFC? See that? All right. A lot of times parents are working We know that we have a lot of parents that are now working, and grandparents, as well as aunties and uncles, can sometimes step in. As a part of the community, they can also be a vital pool of resources for volunteering. Remember that just asking can help parents feel valued. Even if they say no because of time or other restrictions, they may have someone else in the family that can also step in and be of assistance. A lot of the more seasoned volunteers have a wealth of knowledge to share. They are the been there, done that generation, and it can help for connecting with new parents if grandparents also get involved. For those parents who do have time constraints, volunteer work can also be done outside of the classroom or the event. By utilizing their strengths, parents can do calls or help create flyers or upcoming events, organize a needs list, etc. All kinds of ways to maybe pull in a parent that you normally wouldn't think of to help with volunteering. Okay. So this year, we saw a decrease in the amount of parents who said they participate in family events, activities, or classes at their program. Just like we saw uh, the lower amount of parents who felt connected to community. 36% of parents responded somewhere between being somewhat or not at all, which echoes those feelings of disconnection that we saw earlier. Our goal is to help make those parents feel valued and connected. So let's talk about our common barriers. Often parents are citing the same kind of barriers that you're probably seeing in your programs too. Everybody's dealing with the same kind of thing. Timing. Busy work schedules can make it near impossible, but it is possible to offer options that are a little out of the norm, such as the multiple time options, mini workshops, piggyback on existing routines, take home options, like we were saying, maybe asking them to help with the flyer, if there's something they can do on the weekends. Transportation, another big favorite. Um, those who live in rural areas may not be able to even get to events that are off-site or even anywhere for that matter. So when we look for solutions to the barriers, unexpected ideas can form, such as programs that are using carpool coordination, where they help connect parents that live close by that they can share carpool. We're connecting community because the parents are getting to know each other, as well as helping establish a more united front of everybody coming to the event. Excuse me. Check bus route times. If you let them know ahead of time, we are doing this event at this time. Here are the bus times so that you can get there on time. If they don't think about it, when it's time to go to the event, they're like, I don't have a way to go. But if they already know and it's set to show them what to do, they're more likely to say, oh yeah, I can get to there. Neighborhood satellite events. So you do a couple of things. Maybe it's a workshop. Maybe everybody gets yarn and a crochet hook, and you get together and you satellite a virtual event where anybody who wants to learn how to crochet can. It's something that can be done. They can do it from where they're at. It's not a costly thing either. It's just something fun that can create that community even with that barrier of transportation. Ooh, here's another one we see a lot of when we do our parent gauge assessments, and that's the child care. The ultimate goal is to make attendance as convenient as possible for parents, as they are the heart of our community hub, more so than, extended family. Though we do want everybody to be a part of it, really want to focus on those parents. They are the foundation, and engaging them is the key to our success in creating community. So by incorporating family into the event with activities for all, we can help alleviate this issue. And we're going to talk about that a little bit more here. as we go. Here is another chat question for you all. What are some of the barriers to attendance at parent engagement activities at your program? Are they the same as what we're doing, as what we've shown? Do you have others? Did you find solutions? We want to know. If you've got a solution, we want to know. We want to share it. Work hours, transportation, finding the perfect day and time. You will never be able to find your perfect day and time, you all, because what works for one does not work for someone else. That's just the way it goes. But maybe if you split that, if you split an event and make it, we'll have it at this time for the morning and we'll have the same one in the afternoon, maybe then you'd be able to get more people to come to it. It's a little bit more work, but if it brings in those parents, might just be worth it. Work, sports, sports. Kids have busy schedules, not just the parents. That's a really good point. Thank you. Same day activities. Love that. Thank you so much for sharing all those. You know what? Sports events is not something I would have thought of because I'm thinking 3 and 4 year olds, infants, but yeah, they're out there hustling in their soccer team too. So that's a very good point. Okay. So let's go ahead and Manly Men Mondays, cook, chew, and chat. Ooh, I like that. That's a neat idea. Language barrier was one reason parents would not attend or engage in activities. However, now many parents feel more confident by using translation apps. That is so great. I know that there is one program that they went to like their local community leaders that that had that language, and they asked for certain things if they could have somebody volunteer from there to come and maybe translate for them. Just at like an event or something that might be something that would work good. We offer daycare and dinner sometimes. Oh, I love that. Staffing shortage, not able to flex time to provide engagement opportunities in the evening makes total sense. We know that there are time constraints for you all too. Okay. So let's go ahead and let's move forward and let's get curious. Ultimately, one of the best things we can do is ask our community a simple survey or even just asking them directly, will you help, to see where a yes might be more possible when inviting to an opportunity to volunteer. If you create a focus group and get feedback from different viewpoints, IEP families, new families, the cultural communities that are within your program, see what kind of feedback you get. Our parents are the best place to find where the needs lie. Okay, so how do we utilize our volunteer pool? Let's talk about that. How about based upon their interests and their strengths? If you use those surveys and focus groups and ask questions such as, do you enjoy meeting and connecting with others? Or are you a born organizer? This can help you find the right fit for that parent, grandparent, or family member to feel more comfortable and happy to be engaged. As an example, asking an introvert to host a coffee chat might not work the best. But if we already know where their strengths lie, we can use them in the places that fit them best, and we're more likely to get a yes. Also, don't forget, even if you get a no, if you went to them and said, hey, I think you are a great organizer and we could use your help, even if they say no, you have given them this confidence that they are seen and you know what they're capable of. And that's a great thing. So even if you don't get them to volunteer, you're still making them feel a part of that community. When it comes to volunteering, sharing opportunities with the whole family as well as the parents can give our little learners a sense of connection between the family dynamic and the Head Start community. Now, I know there's a lot on this slide, but let's take a look at it. for the parents, when time allows, can volunteers at the event. But as we've stated, they can also assist with organizing and prep when possible from home, thus being a part of it still. Grandparents may have more flexibility to volunteer on site and can be great leaders of parent workshops, bringing their knowledge and insight. Other family members may be able to pitch in when parents aren't available and can also possibly have more time and flexibility. Aunties, uncles, cousins, any adults that are within that family structure can be utilized. Now, this one's my absolute favorite: older siblings. A great resource as event helpers. They can help pass out supplies. They can even just be spot on encouragers. Hey, I really like that picture you're drawing. Or wow, look at what you made here. That's really great. Uh, they can be wearing name tags that say things such as, "Hi, I'm Clarice, Tommy's big sister." This makes them feel that they are a part of things, and it can alleviate the need for missed parent participation due to childcare issues. But also, it helps the families flow. You know, the older kids see the little kids. Well, I was the oldest kid and I saw them as pests. I'm not going to lie about that. They were pests. But if I am integrated into something where I am shown how to encourage and I am taught how to assist, it changes the whole family dynamic and helps those kids to better connect as siblings. And hopefully they don't dunk each other's heads like we used to do. All right. Um, so, maximizing our current events. Programs do not have to start from scratch. If you look at your engagement calendar and regular activities already planned for the year, are there any special tweaks you can do to help better cultivate your community and make the event the inclusive gathering you want to have? If we think outside the box, we can see different things. Go ahead and let's go to the next slide then, Sandy. Thank you. Okay. You don't have to answer this in the chat, but here are a couple of things to think about when it comes to updating your current plans. Start small. Think about just one program tradition that you already host. Are there any community partners you could bring into your program planning? And I see I'm taking up a lot of time here. I'm gonna quicken my step here. Here's an example of an easy way to bring cultures together for families. This could also tie into your nutritional goals, helping you fulfill your PFC family well-being goal, and showing an example of your continuous quality improvement. One of the things that would be really great is if you did have the garden and you had leftover vegetables, to ask them, here is a list of foods that we have. What is a recipe you would use for this? Just brings everybody in and together. Okay. So, want some more ideas? Ask your families. Assessments that ask specific community engagement questions, kind of like what we do with ParentGauge, with our open-ended questions. These offer a wealth of ideas and resources directly from the families. These are quotes that families have done from our assessments. And what they've said is they are looking for events that help the parents interact more with each other. I would love to see more field day, family day types of events. Art, sewing classes, and activities with kids. The classrooms go to the senior center, and I would like to join. Play dates or dates in the park. All kinds of things that you can include in there. So now that I've given you a ton of info that was just way too much, I'm going to pass this on over to Caitlin, who's going to talk about how data can be used for this.
Thank you, Lucretia. And hopefully my audio is a little bit better now than it was earlier in the call. Okay, I'm getting some thumbs up. Cool. Okay, so I'll go relatively quickly. One of the things I spend a lot of time thinking about is how we can use data to deepen our engagement efforts. Like you've heard, there are so many great ideas, and I know Head Start providers are innovative folks. We are an innovative community. We all have tons of things we'd love to try and do. However, as we've talked about, we only have limited time and resources, and we know families are super busy as well. So I want to focus on some things we can do to use data to really enrich our efforts and help us use the time and resources we have most effectively. Due to time, I'm going to go through this fairly quickly and at a fairly high level, but I wanted to empower you all with kind of 3 things I usually think about and 3 steps I take when I'm thinking about how to apply data to a question. So like I said, I've worn a lot of different hats in Head Start. Often I am pulled in to a service area to help them solve a problem or answer a data question. So one of the things I think about is, first, what are the existing data sources or tools that we can use to better understand the scope of the issue we're trying to tackle? This can be an existing data set, data that's already collected, or a tool. I like the Child Opportunity Index for broad information about a community. I'm not sure if I've frozen. I will keep talking and hopefully you all can hear me. But if I have frozen, I do apologize. Awesome. Great. Like I said, I like the Child Opportunity Index for some broad information about communities. I'm going to tell you a little bit about Head Start Link, which is something we're developing to help members dive more deeply into community data. But the point of this data review is just to help you wrap your arms around the questions you have, the work you want to do with families, and really get a sense of what are those questions you want to ask? What do you most need to know from families? Second, once you have an idea of your question, like we've talked about, go ask families. There's lots of ways to get input from surveys, focus groups, tons of different ways to get feedback from folks. And finally, once you've identified a barrier that you want to remove, a change you want to make to your program offering, co-design that solution with families. Invite them into that ideating, brainstorming space, because that will help you know that the change you're making is actually improvement and not just a difference. Because I know that we've all had different times when something has happened in our work, in our community, we're like, well, that's different, but I'm not sure it's that much better. So if we go to the next slide, this is an example from Head Start Link, the community dashboard that we are developing and which is about to go live. This is centered on Travis County, which is where I live in Austin, Texas. I'm just using numbers I'm familiar with. So some things I know about my community, even without looking at this data, I know that the cost of living is really high in our city. The median household income is around $97,000. But almost 15% of children under 6 live in households whose income is below the federal poverty limit. And almost 40% of renters spend more than a third of their income on rent. So those are some things that are just really stand out to me when I look at this data that comes from the American Community Survey, which is collected by the Census Bureau. But perhaps I've been called in to consult with our health team. They're really worried about getting health screenings for children. And so I look at this data and I see, wow, almost 10% of children in Travis County have no health insurance coverage. I want to get curious about that and I want to go a little bit deeper. Can we go to the next slide? So the next thing, as I go deeper, is I might look at a map to see where are the children who are living in poverty. So this map on the left in kind of the orange maroon is a map of the census tracts, the individual neighborhoods that show where are the children under 6 living in poverty, what neighborhoods are they in. And I can also see the little pins. This is the Head Start service location data set. This is the publicly available data set of where are Head Start centers located. So I can see, I might zoom in on perhaps this kind of northeastern quadrant, that there are several census tracts clustered together with several Head Start locations there as well, where I'm seeing there are quite a few children living in poverty. There's also a relatively high percentage of children with all their parents in the labor force. These families really need childcare. And I can see that in this area, the median household income is below the national median. You can see that area in green showing that it's below that national median income of $78,000. Can we go to the next slide? So that gives me a little bit of information about perhaps an area and a set of schools that I want to get really curious about. But now I really want to dive into my key question. How do I connect families to health services? How do I make sure that children and their families are healthy, have health insurance, are able to see a doctor when they need one, and are getting those important preventative care? So you can see I'm looking actually at the two left-hand maps. The top one, you can see these areas in kind of the white and cream color. That's showing a lower percentage of adults who had an annual checkup. And on the bottom, you can see the teal color showing a higher percentage of adults who lack health insurance. So you can see in that same area where you have a lot of children under 6 living in poverty, that also many of the adults in those areas also don't have health insurance and are not connected to a primary care provider. So when I think about how to advise my colleagues on the health services team, I might be saying like, hey, there's something going on around these schools. This might be something you want to get really curious about. But again, until I ask parents what the barriers they're experiencing, I can't create a solution. This gives me a lens. It helps me narrow my focus, but it doesn't replace needing to actually talk to folks and ask about, hey, what's your experience? What are the things that are standing between you and a primary care provider, and how can I help you? How can I help you reach those goals? So if we go to the next slide, I'll give you a couple tips that I have for leveraging data. Like I kind of touched on, pair quantitative and qualitative data. Pair numbers with stories whenever possible. The numbers help you know kind of what to focus on or where you might have questions. The stories will help you get to solutions. Those will be what help you understand what people are actually experiencing and what will actually make a difference and make an impact. Make events and feedback opportunities accessible. Think about the time. We've talked about time. We've talked about language. Also think about, are you offering, are there recorded events? Are there virtual events? Are there things that people can fill out on their phone quickly or pick up and drop off? Like, what are those different ways that people can have to engage with your feedback process? One tip that I think a lot about these days is meeting families where they are, and particularly that when you're doing anything virtual, like surveys, data dashboards, communications out, make sure they're optimized for mobile viewing. So many people, and including, many of us on this call, do most of our computing on a phone. We don't actually sit down at a computer all the time to do work. And so that would be something that would be really helpful. And finally, we heard before, parents really appreciate follow through. We heard that makes a big impression. So whenever possible, close the loop. If you ask families for feedback or input, make sure you share what you heard. Make sure you share what next steps are or what new questions sparked for you. You don't have to have a perfect solution all wrapped up in a perfect plan, but everyone appreciates closing that loop and having that follow through. So with that, I will turn it back over to Sandy.
Thanks, Caitlin. That was all very interesting. I think it's always good to hear about this we've talked a lot about like these anecdotal things and then talking about this like harder qualitative data and then some of the things that we're seeing I think even in the chat how we're seeing, stories about how much our parents are working, right? There's so many conflicting work schedules. That is such a big part of it. And then that a lot of our parents are paying 40% of their 40% of their income is going towards rent. So it's like those things going hand in hand, I think are things to be curious about. But anyways, I knew that we were going to be cutting it close. There were a couple of questions in the chat. So by all means, folks, we will be sending out this recording. Our emails are out there. So if, by all means, you can reach out to us if you have any questions. We hope that this sparked some conversation, some curiosity there. We have that first impression audit out there. So if that's something that you can take away from today, a space improvement, a way to gather input, and how that can connect to your long-term goals of what kind of community hub you'd like to be, what success looks like for your specific community, because ultimately we are the experts in our own communities. So these are ideas to spark what that would look like for your particular community. We will be reaching out with a recording of our session today. There were a lot of really interesting questions, so if you get follow-up from me also, I might be following up with some of y'all. Keep an eye out for that. If you have any questions for us, here are our main emails. Feel free to reach out with that. Or if you have wanted to get any more information about some of this research that we had out there or the products that we mentioned today. Again, thank you so much for joining us today, especially for this fast-paced, um, action-packed webinar today. Thank you so much. We will talk to you soon, hopefully. Have a good one.